Good afternoon, this is Dr. Do again. This video is it's alphabetic list of problems, still on letter C. Today I'm going to talk about the congenital heart disease. Usually there is a variety of either the malformation of the heart structure, for example the transverse, change of location. Usually we have the heart on the left side, and some occasional case has the right, and also the blood vessel just connected to the different chambers and all the fallot syndrome. But those are very serious actually. Some of them even not life compatible, and during the birth will be identified, will be treated, or just so it's I'm not going to talk about those. I'm going to focus on the valvular congenital heart disease, just cardiac valve problem with the genetic cause, or not genetic cause, but inborn with those kind of conditions. So some of them are really preventable. So today I'm going to focus on because of the echocardiogram, the image study, it's really advanced, and it's not difficult to diagnose. So preventive, really, I think it's the most important in terms to decrease the incidence of this valvular congenital heart disease. At the same time, decrease the serious complications and decrease the mortality later on. Some of these congenital heart disease really are symptomatic until later stage. When getting older, the heart burden is increased and then start to show symptoms. Some of them can start to show the symptoms at early stage. So what are the causes of this congenital heart disease? Many causes during the embryonic stage. Medications is the big one. So there's so many medications can cause heart disease. So before you take any medication, even though you're not pregnant, or if you're planning to, if you had the family planning to be prepared for getting pregnant, then watch out for the medications. Usually there is a warning of on the side effect, whether it's toxic to the embryo, whether pregnant woman it's harm or not harm, whether there is some toxicity. So so if you are planning to for pregnant, then watch out with medications, different category, and if you're not sure, consult with a physician to make sure you're taking the right medication. This is the pre-pregnancy, even though you're not, or you're planning. If you are pregnant, especially the first trimester, the first 3 months are very critical. Many medications can be used on the second or third trimester, but not the first trimester. So if you know you're pregnant, like I said, continuously, if you're planning, if you know, then particularly the first trimester, make sure consult your physician before you take any medications. And during the second or third trimester, of course, because the prenatal care, you will know, your physician will let you know what kind of medication you can take. The supplement, like multiple vitamins, that's safe, we all know it. And some of the diabetic medications, it's safe, some of them are not. So this is the big category causes the congenital heart disease medications. And the other causes is the substances, alcohol, for example, very straightforward. Even caffeine can cause this problem. Alcohol is a big one. If you're planning to for the baby, or so, then you need to consider how to tapering down the drink. So sometimes people say, I'm a social drinker. Social drinker means it's a very vague concept in medical standpoint. So if you check the alcohol criteria for toxicity, or dependent or problem related to the alcohol use, you will find out 0 or 1, 0 or 1. That's just if you drink, you just will have the problem. If you don't, just without any gray areas. It's a very sharp line to separate drinking alcohol, non-drinking alcohol, which means it's particularly significant for the pregnant woman. So if you're planning to have baby, then you need to consider to limit alcohol consumption, because alcohol can cause many problems, including congenital heart disease, and the other substances like tobacco and all the other substances, not prescribed medication or not the over-counter medication, just elicited or the happy material make you high, like epinephrine, similar products. I'm not going to list any of them, but just a group of those can cause the congenital heart disease. So if you're considering to have a family, to have children, then you need to think about that, to clean for a couple of weeks, make sure that there's no remnant of those chemicals in the body. Even the smoking, you need to quit it before you are planning to have a baby, because smoking not only cause the cardiac congenital heart disease, many other diseases can cause by the smoking. And so these are the major problem causes for the congenital heart disease. Other causes, the genetic reason, family history. Those are the many of those genetic diseases, like the glycogen storage disease or other kind of connective tissue disease, or they all may associate with the congenital heart disease, like the Marfan syndrome, for example, is a very typical congenital heart disease. So this is, and then during like I said, the diagnosis is not difficult. There could be the congenital heart disease could be the valve stenosis, or the regurgitation means not closed tightly, or so. And then there's a mitral valve, tricuspid valve, aortic valve, or pulmonary valve. So these are located usually in the old fashion, diagnosed by the symptoms, whether cyanotic or non-cyanotic, and also the stethoscope. Just listen to the murmur. So nowadays, really, those are just give the proposed could be the diagnosis, but the confirmative diagnosis is through the echocardiogram, watching the valve movement, whether there's a regurgitation or whether there's a stenosis. So because of technology, and in terms of the stethoscope examination, I think it's old-fashioned, but still it's quite useful. That's the first line to diagnose. So if you look at the aortic, either the second intercostal space next to the sternum, and the left is the pulmonary valve, and the cross to the aortic, and then if you have the mid-clavicle line at the between fourth and the fifth intercostal space, that's the mitral valve, and also at the lower border of sternum, that's the tricuspid valve. So these are for the physicians, just give you a hint why the listening during the physical exam, why you see physician listen to your heart, move the position. That's why, because they're listening to the heart. And also, and sometimes the listening to the lung also can give some hint whether it's cardiac related or not cardiac related. But majorly, those listen to the heart. So that's the first line to diagnose, to identify, and then if suspicious, then send you to the image study to confirm diagnosis. In terms of treatment, usually symptomatic management is not the radical treatment. The radical treatment is a surgery to correct the valves and either change the artificial on the later stage or early stage, just to open it up if it's stenosis. So this is a very superficial, very because this congenital heart disease usually it's not uncommon, so it's not difficult to diagnose, and it's not difficult to treat if it's identified. Just the preventive part, I think, is more significant. So that's why I threw it here. You probably already know it, but I just put here to remind you. Thank you for watching. I will see you next time.